Welcome back. So, moving on to the next panel discussion after the fireside chat which we had before lunch. So, the fifth panel discussion will be about insurance being as a tool to support the care continuum from OPD to home care. We were actually discussing about this concept a little while back in the earlier panel discussions as well. So, for this session, I would like to invite Mr. Shamik Banerjee, once again, Chief Marketing Officer, Apollo 24/7. To moderate the session. Sir? Yeah. And for the session, the panelist will be Mr. Anshul Mittal, appointed actuary, HDFC Ergo General Insurance. I request sir to please join us. A very brief about sir. He serves as a joint president and appointed actuary at HDFC Ergo General Insurance, having over 15 years of rich experience in the general insurance domain. Seasoned actuary, leads the actuarial, retail underwriting, analytics functions, playing a pivotal role in shaping the company's strategic direction. As a member of the HDFC Ergo's executive committee, he plays a key role in driving strategic decision-making and business efficiencies through analytics and AI-led insights. He has previously worked with ICICI Lombard in actuarial roles, qualified fellow actuary from the Institute of Actuaries of India and the Institute and Faculty of Actuaries UK. He brings a strong blend of technical expertise and business acumen to his role. The next panelist for this particular session is Mr. Vishal Athwal. He's the CEO of Apollo Homecare. He's a seasoned professional with over 16 years of experience across the healthcare, automotive and consulting industries. As the CEO of Apollo Homecare, part of Apollo Group Hospitals, Asia's largest integrated healthcare provider, he is leading the transformation of home healthcare delivery in India through innovation, empathy and operational excellence. Throughout his career, he has demonstrated exceptional leadership and strategic foresight. His deep understanding of direct-to-customer model and passion for building scalable healthcare solutions have been instrumental in driving innovation and accessibility. Before joining Apollo, he was the founder member and the head of business at Max at Home Healthcare division of Max Healthcare. His professional journey also includes impactful roles of globally renowned organizations such as Mercedes-Benz, Mercer Human Resource Consulting, Hewitt Associates and Godrej Hershey Limited, where he honed his expertise in business strategy, operations and people leadership. An alumnus of the Delhi University, he holds a postgraduate program in management from Great Lakes Institute of Management, Chennai, and the executive program certificate from the IIM Bangalore. With his proven track record and visionary leadership, he continues to drive Apollo Homecare mission of redefining healthcare delivery, bringing hospital quality care to the comfort of homes across India. Shamik sir, over to you.
Thank you so much. Always the toughest session. People had lunch. We have to make it interesting. And we have to talk about insurance, healthcare, and yet make it interesting. But yeah, insurance, healthcare is also interesting because the potential, the innovation, and the way this industry is moving towards. I really like the session name, right? It's about stretching insurance as a tool of affordability for the entire health continuum. Just to put things into perspective, in the morning I was talking about 9 lakh crore is the healthcare spend, 3 lakh crore comes from insurance. In today's India, bearing few parts, only hospitalization is covered under insurance, which means in a car, suppose you are insuring only the tires. You're not insuring anything else, right? But the potential lies in insuring the entire continuum. And today we have two of us, Anshul. Anshul is one of the best actuaries we have in this country, who prices an insurance product, who actually understands the risk and tell us how do we actually make sure a product gets built. And Vishal is a part of our Apollo Home Care. He is that person who is trying to set up a business which is after you cross the hospital or before you go to the hospital. So I think it will be a great session, right? I'll start with Anshul. Anshul, how do you look at this extension? Because in India, 1996 is when privatization happened in insurance. And in the first 10 years, health insurance was never there. Fire, motor was tariffed. De-tariffing happened. Health insurance got its own space. That's where the new health insurance company came. So 2005 to about 2015, we saw a huge amount of innovation. Products, services, claims, a lot of things happened. 15 onwards, it's most like making the machine better, right? How do you see the next few years? How do you see the insurance extending from just being an IP product to a full health continuum?
First of all, thank you, Shamik, for having us here. And I think what you are saying is, I can't deny that insurance in general, health insurance has come a long way. If you see, most of the general insurance company used to not even focus on health insurance. If you see 2010 to 2015, health insurance is not that for a private sector. But still large of the market is still today dominated by indemnity healthcare, basically paying for the claims. But if you see closely, Shamik, there is a very positive green signs that we see. Like most of the product now has a health checkup, continuation of cover, home care, and to that extent, it is a reward of getting the fitter. Insurance is slightly expanding its scope from not only paying claims, but also reward for getting the hospitalization, getting the fitter. So I think it is slowly changing, and I see two reasons for majorly people are not aware. Most of us in this hall also would not be aware that health insurance cover a lot of things beyond the indemnity cover. But people are not aware, and insurance companies are proactively, as an industry, we have to make an effort to educate everyone that not only health checkups are covered, but also the post cares are also covered, and it is in the interest of you as a customer to avail that. Also, the whole ecosystem of the insurance, of the health insurance, it is not evolved as of now, because lot of focus is on the indemnity. Still the product coverages are there, but the ecosystem providing it, servicing digitally, it is still not there for a customer. But so I can comment on my company, we at HDFC Ergo, we are doing many experiments in finding different covers, and we believe once the vast regulation gets enabled, that would be a turning point. That could be a turning point for the Indian health insurance market, and that will give you a upward growth. And that market beyond indemnity insurance could be a very sizable market, because then I can be a part of the ecosystem of a customer. I can very well invest in getting the best of the best health checkup, getting the health map of a customer, and providing a continuum care. So still a lot of growth. It is the fastest growing sector in the insurance industry, and I believe enablement of VAS will be a turning point, Shamik, in my opinion.
No, great point. I think no denying of the fact, right? Because it's an industry growing at about 22% year on year for the last 15 years now, and it will go more. And just think about it: 9 lakh crore going at 20% year on year, and the only 30% is covered by insurance. Huge potential is humongous, right? And you're right. So I think still now we look at the very basic hygiene insurance. How do you look at it, Vishal? How does the business like home care, right, which has got various aspects to it, before hospitalization and after hospitalization, how do you see the insurance as a tool comes into your customer value proposition?
So I think India is a market of varied proportions, right? Accessibility, affordability, we talk about all this, but at the core of it, the point is that one, we need to define home care and understand it a little better. Traditionally, home care is understood as sending a nurse or a caretaker at your place, right? So even now it is, whether it is insurance or by the common parlance, it's seen as a luxury service or assisted care. I think the clinical definition of home care is still missing, right? There are enough doctors in the group, and there's enough healthcare IQ in this group to know that there's a lot that happens pre and post hospital that impacts the overall recovery of every process, right? And when I talk about recovery, I think if we are to address what Anshul rightly said, both the models work on very, very different formats. So the underlying attribute for insurance to do well is if you have more fitter people coming into the fold, right? Whereas healthcare thrives, at least the business side of healthcare thrives on people getting sick, right? So you're sitting at a dichotomy and you're wanting to make these two sides work together, right? And it cannot happen just purely by business economics and a valued proposition. One, health as an agenda has to come up to the fore, which has happened, right? We are seeing more and more consumer activism on health. The other way to bridge this trust gap, which is not just between a patient and a provider, but also patient, provider, and now insurance. One common currency is if we all start talking about overall recovery. If that becomes the primary goal, and I think the conversation on the preventive side is good, but the conversation on post-hospital is not there. It's practically missing, right? I think Anshul gave an example that if we were to just map out policies, about 8 to 10% of policies will cover some of the other post-hospitalization services. But we know enough that with stroke happening more and more, and sooner in your life stage, right? With cancer burden going up, with chronic disease burden going up overall, post-surgery continued care is a solution that is needed. And that to me is true value unlock of home health care, right? Because then you're solving for the pain for the patients, right? Which is continuing the care ecosystem. The providers, because then the providers or hospitals have enough and space capacity, they get a capacity unlock by moving the patients out. And for insurance, it's overall cost of the treatment and recovery rather than just a part of the puzzle, right? So one, the home care definition and understanding has to go away from just a caretaker where there is a huge conversation on, oh, it's long format, it's going to be cost additive, it's not taking away the cost, and it's already tending to the frail and the sick, and therefore, why should I work on it, etc. Right? So, I think that concept needs to change, because with 3 or 4% of India being hospitalized and 20-25% of those people needing, that's 10 million people every year, and look at the readmission rates. Right? That will just talk about the argument in the simplest form of why we need to look at home care differently, and we need to look at the preventive side and as well as the post-hospital side.
Very nicely said. I think, yeah, right. I think two things come out very well, right? One is insurers feel that wellness or staying better life or better in health makes a lot of difference in terms of how to handle this. And what Vishal is saying is that home care as a space is evolving in India, and we need to define it. My brother is a scientist, and I was talking to him. He does work on anti-aging, and he said a very interesting thing one day. He said that, look, human being is suicidal in nature. We want to die. We want to see Netflix. We want to eat junk food. We want to do all the bad things in the world. We human being incessantly wants to die. We are suicidal in nature. Right? That's what we always do, because we are not here to live more than 35, 40 years, but now we are living 80 years, 90 years, and we have a life of after 50, 60 years, which is quite tough. So we are suicidal in nature, and we are talking about wellness, we are talking about let's stay healthy, we are talking about all the fitness bands in the world. And
a bit of a morbid conversation after lunch, post-lunch, but I agree, which is why I said post-hospital care, right? So it's not just preventive, which is one part of the puzzle that we've solved. But with medical advancement happening and people living longer, etc., you need to address that population. And it's not just the silver economy of graying, aging people, etc., but it's also living with diseases for much, much longer lifespans.
Absolutely, that's what I was coming to. Absolutely, yes. Because if people are living long, they're not supposed to live long sadly. They're supposed to live the entire life happily, right? Now, what I was coming to is this holy grail of OPD, which is called outpatient dental insurance, right? Which is basically saying that you can go to a doctor, take a paracetamol or take any medicines that they give, or take a blood test or do a small test, and insurance will cover it. How many of in this room has gone to a medicine shop and said, "Bhaiya, জ্বর হয়েছে একটা ওষুধ দাও"? How many of you have done it, right? We all do it. We go to a shop and say, "জ্বর হয়েছে একটা ওষুধ দাও. Give me a medicine that I am having fever." Why is it so? Is the doctor not available? Just because we said that, what's the point in seeing a doctor and spend some money, right? So there's a huge scope definitely exists. Do we agree, Anshul? And where does this go from here?
So Shamik, you have shared at least very interesting topic on the OPD. See, OPD is a first line of defense in the healthcare. You get to know, you can treat the person instantly, or at least prevent it to be becoming a major disease or anything. But unfortunately in the insurance, I can comment on the insurance part of it. Unfortunately in insurance, it is still out of pocket expenses. Majority of the expenses in OPD is out of pocket. Insurance does not cover it. Now why? And at least, and Shamik knows very well that we have tried multiple insurance models in OPD, and we want to experiment because this is market we want to crack. This is a market we believe that it's a huge potential. But there are two main challenges. One is that in India, the trust in insurance is still not at that level, and both from point of view of insurance company and also from a customer point of view. I can talk from as a customer point of view also. So there is a anti-selection if you go on one side of a cover where customer wants to cover everything, just like indemnity plan, where customer has a plan today where anything is covered under the sun. You go to the best of best hospital, you go get admitted into best of best rooms to get treated. Well, the same expectation is on the OPD side also, but the market is very fragmented there. So anyone who is trying to get into that market, ultimately insurance company does not succeed. And then on the other side, it is a very restricted cover, but providing a subpar coverage. So customers are not, customers like you, me, or anyone in this room, they would not want to go to a doctor which is 50 kilometers away for a medicine, for a basic disease. So we have tried multiple models. So, but what we finally realized, Shamik, that at least in OPD, a gatekeeper model, and a lot has been said about gatekeeper model, but that is a more sustainable point, because what as a company I want to give a cover which is sustainable and a reasonable cover to a customer. And customer is also expecting that it is very easy to, claim. So there are two things which we have realized. One is that a gatekeeper model will have to be there. You can't survive without a gatekeeper model with the cost going rise. The second is the whole ecosystem. We can't imagine the OPD ecosystem like a IPD where a customer will share the bill with the TPA team and TPA team will take some time to process. They will share the query. This is done. That's not how it's going to. So it has to be fully digitally stacked. And also where I can control. Today as an insurance company, I do not control where the customer is going. Line of treatment, the choices that the customer is making in the inpatient. I am as an insurer only a financer. But if I do replicate same in OPD, then it is not going to work. So that's why a gatekeeper model where I can control, and it will work in interest of both as a customer or as an insurance company. So this is what, as of now, we believe that our gatekeeper model, Shamik, will be a great area to start in the.
No, fantastic idea. Just to explain everyone what Anshul is saying is a breaking idea, right? What he's saying is that yes, OPD needs to come under insurance. Yes, there is a way to build a financial tool for small illnesses, which actually does two things. One, it also keeps the risk at bay. For example, if someone is caught the heart problem at a very early stage, I can defer a heart surgery or something by 5 years. That 5 years, the claims gets deferred and the loss ratio comes out, the entire industry gets better. And to do that, what is important is that we have to cut inefficiencies, right? Where people can show bills and fraud. So he's talking about gatekeeper model, an ecosystem which is digitally completely stacked. And I think Apollo has been trying to do that and making sure that a customer is actually have a pathway to see a doctor, buy a medicine, take a test, and if required, go to a hospital. I think that's what he's talking about.
So I'll just add, Shamik, and you have said, and of course you know this model more than me, lot of companies are now investing in it. It's not that, a lot of good amount of money is being invested in this model now. So definitely everyone knows that this is the direction for a more sustainable, managed care portfolio.
Absolutely. I think, Bill Gates once said, we always overestimate in short run, underestimate in long run. I think in the next 5 years, the biggest chunk of this revenue, if comes from OPD, I'll not be surprised at all. Absolutely. It's just a huge amount of potential to open up. How does that change, Vishal, your presence and your sort of business? Because if these things comes in, things will be looked into very differently, right? And then you don't look at it as a luxury or someone taking a expenditure which is not required. It comes at a very different thing, right?
Yeah. So, see, we're in very interesting times. So there are macro trends on consumers that are happening. So we are out of the demographic dividend peak, right? We are now getting into the aging peak, right? So our models, our products, our insurance covers, our policies should not be dated 2019, 50, etc. Right? So we need to move really, really fast. So demand is moving at breakneck speed. It's anyways there. The challenge really is how do you solve for supply and for the right pieces, right? Healthcare is underserved massively, right? You cut it by any proportion, whether it is primary care, which is very fragmented. Hospitals take time, and the good ones take time to come in, etc. There is a gestation cycle. It's capital intensive, right? And then comes the challenge of solving for these customers across the care journey, whether it is digital, where the acquisition cost and tech platform costs are just prohibitive for a lot of people to build and scale, etc. Similarly for home care, right? The supply, quality of supply, availability, etc. becomes a challenge in itself. So, if we really are to solve for what we see in the future, which is, as I said at the beginning of my first question, was that if we underlying everything on overall recovery, I think we will have these formats will start to change and evolve. So, for example, even at Apollo, when we are building the what we call loosely as care continuum piece out of hospital, right? We don't really call it Apollo Home Care. Is people will need differential treatment at every journey. So, you have to look at transition care facilities, right? Where cost of treatment goes down. It could be long format, right? It brings the right care to them, but you don't have to pay for as elaborate infra or those costs, right? That's one model, which is still out of hospital, not really home care, but it's out of hospital. Second is then what part of it goes into home, which is clinical, and what is social as a need, right? So clinical is, for example, today, as I said, 25% of most of your discharge volumes will need some care continuity. And the lack of this is leading to readmissions, poor outcomes overall, right? And frankly, just bad revenue for the entities. And the increasing cost covers, claims ratios. So we will have to create productive models at scale using telehealth, remote monitoring of patients, right? And bifurcation of all of these patients into what are the clinical needs, right? So 1-to-1, 12-hour, 24-hour cover, etc. is not the future of home healthcare, right? Or extended care models. It has to be care at the right time, by the right skill set, over the right format, right? Providers are increasingly, I think, pushing the envelope and solving for this because they have to, right? The supply is just not there. But if I just to add and summarize this, see, insurance want low claims ratio, right? Patients want home care. So it's the recipe for the right arranged marriage, but that arranged marriage is yet to happen, right? And for that, the ecosystem has to come together.
So I'll just add to what Vishal has said. Home care is the most desirable, but yet it's the most wanted feature, but it is not unused feature in the insurance policy. The reason is, and we tried it, we thought that why it is not cracking despite of being such a high potential. It works in all the interest of insurance company and a customer. So what we did that we have a 5 million retail health customer at HDFC Ergo. So we thought that customers who are claiming again and again, let's try to build a network and try to give a best of best home care for them. Let's experiment this. And you won't be surprised, but you will be hugely surprised what we experienced as an insurance company. At least we were surprised that there was a cost optimization, better retention of a customer, there was a better customer satisfaction, and for me as a pricing actually also it gives me a predictability in the portfolio. So it is yet to, because of the awareness, Vishal, maybe, or because of the way it is, as you mentioned, it is still fragmented, right? It is still not very much a part of ecosystem. So maybe that thing will be in the future.
It's a great point. That's absolutely a great point. And I think this is a great point to be noted. Innovations needs to come out of the core business and its profitability. If any innovation is adding to the profitability of the core business, that innovation will go a long way, right? So what he's saying is, we can take an example of a company called Ping An in China. I don't know if anyone heard the name called Ping An. Ping An was an insurance company. In China, there is no primary care. There's no doctor. There's very bad primary sector. So what Ping An used to happen is people used to show up at the hospital and they used to have heavy claims. So Ping An as an insurance company felt this way, I will get bankrupt because people will come to the hospital, go for only surgeries and things. So what Ping An did is they made a company called Good Doctor. Good doctor is basically they appointed number of doctors in the country and said, you have to first call my gatekeeper, first call my doctor, and they will tell you what to do. In China today, Ping An gets 5 million calls every day. That's the only primary healthcare sector they have. They're one of the best insurance and healthcare continuum company in the world. That's what exactly says, right? That good doctor has done what? The good doctor made sure that people don't show up at the hospital for every instances. They actually, and hospital also can load it rightly, get the right patient, get the best thing. Everything works. It's a win-win-win for everyone. But that's one of the model that I think India also might have, because in India, as I said, insurance is not pushing the healthcare cost up. It is not. Insurance is actually controlling it in the right fashion, and the constant conflict and the friction, it's good for everyone, good for everything that is happening. But you are absolutely right, and that's what exactly, right? If people takes home care, people takes support, they will have a much better data footprints, much better things. How do you react to that, Vishal?
I think let's not beat ourselves too much, because a lot of innovation is happening, a lot of good work in healthcare in India is happening, whether it is providers or insurance. I think the beauty is how do we build awareness at the right touch points, right? And as you said, the gatekeeper model is one of those solutions, right? At the underlying essence, as I said, is again it requires participation at multiple levels, right? It requires participation at patient advocacy. It requires participation at providers talking to insurance and listening to each other rather than sitting on the two ends of the distrust spectrum, right? And it also requires out-of-hospital extended models to become institutionalized with the providers, right? Which is the good doctor model. It's not, that's more a macro level. But for example, if we were to say that, let's say a hospital procedure comes bundled with pre and post care, right? Which is where, because for an insurance company, the biggest gap is how do I limit the overall cost or keep that in check? How do I improve outcomes? Reduce the risk fraud, right? So institutionalizing continuum of care is the singular biggest value unlock for all of us. Whether it is OPD, hospital, post-hospital, right? And then measuring each of this on delivered outcomes, right? Which is the value-based care model. And that model has done well. Of course, it has its own downside, but every model goes through a cycle, and then of course we have to wait for innovation to come there. But if you ask me, integrating or institutionalizing care for disease pathways is the only value unlock that I see for everybody, and innovation will follow.
Super, what a session. It's a session with a clear work to do. Yes, healthcare financing has two ends to extend. I think the industry can work together. All the provider players, all the site players, all the OPD players and the insurers, if they work together and create something, I think a huge potential can be unlocked. And that's where we end at it. I think it's a good work to do for all of us. Thank you.
Thank you, sir. Indeed, it was a very good session post-lunch. None of us were sleeping. And yes, sure.
Are you aware of anyone trying out the good doctor thing in India? Apollo 24/7.
I request our chairperson to kindly come on stage and felicitate the moderator as well as the panelists. Okay, we only felicitate the moderator once. We only felicitate you once.